This week on Left Hook, Right Jab, the guys are debating health care. With all the President Trump headlines, it's important to remember the Senate is still considering the Republican bill to overhaul Obamacare. We asked Steve Novick and KXL's Lars Larson to debate the bill. Our question this week: should the Senate throw out the bill passed by the House or keep its main points?
They should throw it out. First of all, the House bill is largely just a tax cut for the rich. Under the House bill, people who make their money, rich people who make their money buying and selling stock, would no longer have to pay Medicare taxes. That's outrageous. As to the rest of the bill, well, what did Obamacare do? It expanded Medicaid for poor people, which the Republican bill would roll back and throw people off Medicaid. And it gave subsidies to lower income, middle class people to help them buy insurance. And the Republican bill would roll that back, especially for people between the ages of 50 and 64 who would be incredibly hard hit. So for those reasons, no, the Senate should throw the House bill out.
Steve, you're confused. You didn't read the bill. Here's what the bill does. The most outrageous part of Obamacare was the government saying, you have to buy health care because we say so, and if you don't, we're going to punish you. It gets rid of that. Secondly, it takes off a lot of the crazy mandates, like the requirement that my 70-year-old mother-in-law has to have maternity care. She's not planning to have a baby anytime soon, doesn't need the care, but still has to pay for it. It gets rid of that. It creates a risk pool, shows states can figure out the best way to take care of people with pre-existing conditions, about 400,000 people in America, and make sure they're taken care of. And yes, it does make some other changes. I think the changes are good, and I think the Senate ought to pick it up, make a couple of tweaks, and then pass it promptly.
Before Obamacare, the states never protected people with pre-existing conditions. There's no reason to think they would do it in the future. The mandate was actually a trade-off for the requirement that insurers cover people with pre-existing conditions. The way health insurance works is that healthy people subsidize sick people. We all pay into insurance, even though most of the time we're healthy, and our money goes to pay for sick people, but we know that eventually if we get sick, we'll be covered. If you require everybody to have health care, it doesn't work financially unless everybody also has insurance.
I've got to tell you something, Steve. You're confused, especially on this. Before Obamacare passed, I heard from lots of people who were in the Oregon State risk pool, and most states had risk pools. You didn't even know it existed here. And those people told me, I'm happy about the risk pool. The problem is Obamacare makes the risk pool that's taking care of me illegal. They got rid of it. The new bill allows each state to figure out the best way to take care of those people, and those risk pools worked well, and the people who were in them were unhappy to see them go.
Actually, Lars, you must have talked to the 5 people in America who thought the risk pools were working, because again and again, we've seen the risk pools were not working and people were suffering. But what you haven't denied is that this is a huge tax cut for the rich that will cut support for people between ages 50 and 64 and cut people off of Medicaid.
I'm going to tell you something, Steve. The fact is, Aetna Insurance has now just recently dropped out of providing Obamacare coverage. Other major employers, insurers have dropped out as well. And the reason they're dropped out is that Obamacare is circling the drain. It has to be changed right now.
This bill doesn't fix anything.
And they're out of time. We'll see them again next Thursday.